Upstate Medical University in Syracuse, New York, invites you to Be the Informed Patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Healthy feet are fundamental to the quality of our lives, and there's something we have to look after. For some advice about how to do that, I'm talking with Dr. Ricardo Lundi. He's an assistant professor of medicine at Upstate and a podiatrist who works in the Joslin Diabetes Center. Welcome to the Informed Patient, Dr. Lundi.
Thank you.
Let's start with some of the normal changes that happen to feet over time. How old are we when our feet are finished growing?
So feet stop growing in boys around 15 to 16. The last growth plates will close around 16 to 18. And girls, they stop growing around 13 to 14, and their growth plates will close around 14 to 16. The feet continue to change as we get older, but the main growth stops in the late teens.
What are the main differences between men's and women's feet, besides the fact that the length of time they're actually growing is different? What are the other differences?
Men tend to have larger, wider feet. They're sometimes flatter, and women tend to have smaller, less wide feet, higher arches.
Does menopause do anything to a woman's feet?
Yes, so there are changes that can happen during menopause. The skin will be drier. You might notice changes in the ligaments and how they hold the joints together. The feet might become flatter.
What about during pregnancy? Do you see that women's feet will change during pregnancy?
Yes, so there are changes that happen during pregnancy. The body retains fluid, and so the feet might seem to get bigger because of the fluid that's pulling in the feet. So they might appear larger. The feet might become flatter. You might have some increased pain from the increased weight gain from the pregnancy.
Now, how do diseases like diabetes and heart disease affect our feet, or do they?
They do. So in a diabetic, you'll see changes to different parts of the system. So you'll have changes in the nervous system where people will start to develop tingling and stabbing and burning and shooting and numbness in their feet. They get risk factors for getting wounds that won't heal. There might be changes in the arteries where the person has decreased blood flow to their feet, and that's called peripheral artery disease. And you would see that in the diabetic. And with heart disease, you might see similar things where, the feet might feel colder, and then you have swelling in the foot. So the foot becomes bigger and wider, making it difficult for them to find shoes and things like that.
If a person is prone to osteoarthritis, does that turn up in the feet as well?
You will see arthritis in the feet. So with osteoarthritis, you'll see arthritis forming in the joints. So they'll get pain and stiffness. Some people will get deformities in their foot from the arthritis, especially around the big toe. So the joint might have bony deposits or erosions that will appear underneath the skin.
Does a person's activity level influence their foot issues? Say, if we're a runner, are we destined to have issues with our feet?
You might develop some issues with your feet. People develop things like plantar fasciitis from running and the heel strikes that happen. And so you can get inflammation in something like the plantar fascia, which is the structure that's from your heel to the front of your foot. It can get inflamed. And so people end up with heel pain. You can develop things like tendonitis along the different tendons in your foot. Arthritis can develop depending on the way the person runs. So they might have great toe arthritis from running or sports.
Well, I want to ask you more about the common foot ailments that you see. But before we get into that, let me ask you how you advise women to choose their shoes. Are heels okay to wear?
Heels are okay to wear. It depends on the height of the heel. So, anything higher than 2, 3 inches can cause some instability while walking, but heels are okay to wear. So as far as picking shoes, you do want to pick something that has a support for your arch so that you have that support there and it prevents injury. A lot of the shoe choices will be based on the activity that you're doing. So if you're running, you should get a running sneaker or shoe. And if you're walking, same thing, a walking shoe would be better. And if you're going to work, a good work shoe that has support. Sometimes people will need additional support. And so then getting inserts, over the counter or custom to help support your foot better.
Is it healthy to go barefoot?
Well, it depends. So there's nothing wrong with going barefoot in general, but if you're outdoors, you should be wearing shoes, especially if you're dealing with things like diabetes, where the skin can get pierced and infections and things like that. But for the most part, it's okay to be barefoot.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith, talking with podiatrist Ricardo Lundi from Upstate's Joslin Diabetes Center. So can you talk us through some of the most common foot ailments that you see? I'm curious how these particular issues come to light and how they're diagnosed, and then what you can do about them. You already mentioned plantar fasciitis, and that's that soreness, I guess. Is it from overuse that you feel kind of on the bottom of your foot or in your heel?
So plantar fasciitis, you would feel at your heel, and that can come from overuse, and that can come from sometimes people gaining weight, and then that can cause some tension in the heel as well. It can come from tightness. So in your Achilles tendon or tightness in your plantar fascia could eventually cause some plantar fasciitis pain. Other things that we see in clinic would be things like bunions and hammer toes, corns and calluses, ingrown nails.
So it sounds like most of those things you can diagnose with your eyes just by seeing or feeling
Yes.
what's going on.
Yes. So with a bunion, so a bunion would be a deformity at the big toe and the bone underneath it, the metatarsal, the first metatarsal, where the first metatarsal shifts. And so you see a bump against the skin and the toe moves closer to the second toe. The great bigger toe moves closer to the second toe. And so you can see a bunion by looking at the person's foot, but you can also use things like x-rays to determine how much of a bunion deformity the person has. And similar for hammer toes, where deformity is usually at the lesser, smaller toes, where the toe bends up, and you can see that through your eyes. Same for a callus, where the callus would usually be on the bottom of the foot, and corns would usually be on the toes themselves.
Are these things, because some of them would impact how well a person could walk, are these things that can be remedied? Are there
So,
treatments?
yes, it depends on the goal of a person. So usually shoes would be a really good place to start for most of these things. So for a bunion, you would want a wider shoe. For hammer toes, you would want a shoe that has a deeper toe box, so that there's room for the toes to be bent. And then for things like corns and calluses, you just want a shoe that supports your foot, and you do want to, you know, change your shoe out if you need to get rid of your shoe. It's been more than a year, or alternate shoes depending on the shoes that you're using. Um, but sometimes people will need things like surgery. When surgery is being planned, they will do things like x-rays and discuss the complications and the benefits of the surgery versus trying to fix things with shoes.
When you talked about tossing old shoes, I mean, that's a reality that is hard for some people to come to grips with if you have a favorite pair of shoes. But shoes have a fixed life, and when they start wearing out, they're not healthy to wear, right?
Yes, that's true. Um, you know, Depending on how someone walks, you'll be able to tell where the shoe is wearing out and if it's time to switch the shoes out. For the most part, if someone has an issue like diabetes, they do want to keep relatively good shoes and don't want to wear them past their life.
So on some shoes, there's tread on the bottom. Can you look sort of like you do with car tires to make sure the tread is still
Yes, yes.
visible?
Yeah, you can see where the grips and the tread is wearing out.
There's a lot of issues, it seems like, that could come up with feet. Are there things that we can do to help reduce problems from developing? I know that, choosing the right shoe and rotating it or making sure that it's still in good repair is important. What about something like pedicures?
Pedicures are fine. So making sure that, if you're getting a pedicure, making sure that their equipment is good, sterilized and clean, and they're not being incredibly aggressive when they're cutting the nails. Sometimes people will get ingrown nails. But pedicures are fine. If you're doing things at home, if you're worried about things like cracked skin or calluses, moisturizing can help prevent a lot of the dryness that happens with skin. You're having a
So
particularly hard callus, making sure that you go to a podiatrist or someone who does the callus on a regular basis, so that you're not cutting yourself using some of the equipments that you have at home.
so there is some, we'll say, grooming or foot care that a person can do on their own that can
Yes.
can help. What about, are there any stretching moves or exercises that are good to get into a habit of doing?
Yeah. So for stretching your calf before you go for a run or a walk, stretching your plantar fascia by taking your foot and pulling your foot towards you so that you stretch the bottom of your foot.
Well, Dr. Lundy, I appreciate you making time for this interview. Thanks for telling us about foot care.
Thank you for having me.
My guest has been Dr. Ricardo Lundi. He's a podiatrist in Upstate's Joslin Diabetes Center and also an assistant professor of medicine at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please tell a friend to listen too. And you can rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.